A1C, blood pressure, cholesterol. These are the three ABCs of diabetes. A1C is a measurement of how much sugar is attached to hemoglobin in your red blood cells. The goal is less than 7%. It's checked every 3 to 6 months. One thing I would say is definitely make sure to measure. You can track your A1C on My Diabetes Home, and this is showing you readings for a patient over the last year. Some of the key things that I want to point out, whenever you see an I sign, it will show you some education. What is an A1C? What should be the goals? That's a link. There's a video. You can also see what your targets should be. Color coding. If you're above 8 or below 5, we do it at red, between 5 and 6, yellow, and 6 to 8, green. So around 7 plus minus 1 is the green. And you're able to then see it. Are you doing well or are you not doing well? You can also change the timeline here and you can look at 5 years. Moving to B, the blood pressure. ADA recommends less than 140/90. When you reduce your blood pressure, you seriously reduce your risk for major issues like stroke. Nobody wants to have a stroke. That's the most dreaded complication in my mind. 32% reduction in death and the eye, kidney, and nerve damage. So definitely you want to control your blood pressure. There's the DASH diet. I'm a huge fan of a DASH diet, which can cause substantial reduction in blood pressure. The whole idea is you reduce fat, cholesterol, added sugars, and sugary beverages. What you want to take is more fruits, veggies, whole grains, nuts, fish, and lean protein. Again, you can track your blood pressure and you see how this is color coded. The things in target are green and then yellow and red, depending on how high they are. If you go to a doctor's office and your blood pressure is high because of the white coat syndrome, the doctor would want to change your blood pressure medication, add another one. But if he saw that your home readings are much better, he's going to say, fine, I'm not going to do it. Again, you're your own best advocate. I would say get a blood pressure machine if you have hypertension and then check maybe once or twice a week. C, cholesterol. In the newer guidelines, they have changed to this idea that the number doesn't matter. And based on your risk, you can go on moderate or high intensity statin therapy. All patients with diabetes should be on a statin. They're already moderate risk. Then either it's a moderate or high intensity statin based on whether they have other issues or not. I personally believe that numbers still matter. Otherwise, how would you know that the medication is working? LDL goal less than 100, but if you have multiple risk factors, then less than 70. Remember, LDL is the bad cholesterol, the lousy cholesterol. The lower it is, the better. HDL is the happy cholesterol. The more you have, the better. It cleans up your arteries. More than 40 in men and more than 50 in women. Triglycerides, ideally less than 150, very hard to achieve. Should be checked at least every year. And again, you can see them in this graph. This is so powerful. It can save you additional lab. A patient got her cholesterol done and I said, hey, we usually do yours. Who did that? She got it done at her spouse's annual exam and she put it inside My Diabetes Home. The end result, I didn't do it. She didn't have to donate blood that day. So again, think about all these benefits that you can accrue if you track your numbers. All the ABCs are neatly laid out in My Diabetes Home. A1C, blood pressure, cholesterol, and weight are easily trackable.